Welcome to another episode of the Life in Motion podcast. Our topic today is diversity, equity, and inclusion in physical therapy with our guest, Dr. Jazmine Tooles. Dr. Tooles is a physical therapist with MossRehab Drucker Brain Injury Center in Woodbury, New Jersey. Dr. Tooles is passionately involved in diversity, equity, and inclusion initiatives as she is the chair for the American Physical Therapy Association of New Jersey's Cultural Diversity Committee, the Pennsylvania Physical Therapy Association's Minority Affairs Committee, as well as a leader in MossRehab's Cultural Diversity Special Interest Group.
Thank you for joining me today, Jasmine, as we talk about issues about diversity, equity, and inclusion in physical therapy. You have been very busy spreading your message and trying to make this initiative understand the impact on our profession. Can you tell me about your work and how you became interested in this topic?
Sure. First, I want to say thanks for having me. I'm really happy to be here and have this talk with you. It's a very important topic. It's been a very important topic for a long time, and now with current issues, it's even more out there. So I'm excited to get into it. So for me, diversity has been a part of my life since I was born. I'm the byproduct of parents who were the byproducts of interracial marriages during the civil rights movement. So that alone forced me to kind of think about race and ethnicity and what that means, just through my life experiences. And then growing up, I was an active Girl Scout. So that was a program that encouraged serving the community and being a sister to every Girl Scout. So they really promoted, again, diversity, equity, and inclusion, and being able to relate with and interact with different types of folks. And then in high school, I was actually in Anytown, which is a summer camp for talking about diversity, encouraging leadership in the community. It's now called the American Conference on Diversity. They still do the summer camps. And then in college, I was also involved with the National Council of Negro Women, and then in grad school, the Black Graduate Student Association. So in different aspects of my life, I was always engaged in some type of diversity community organization. And then in 2017, I found out APTA had a Minority Affairs Women Initiatives group. And then I kind of got looped in from there, and it's just kind of taken off.
Now, for some of our listeners here, they may have some trouble really differentiating and defining each one. So could you go ahead and help us define these key terms and what are the differences in the definitions?
Yeah, sure. So diversity is just talking about that people are composed of different elements. There's variety amongst people, right? And when you value diversity, what that means is you recognize those differences and acknowledge that those differences are assets rather than negatives. Inclusion is more so when people who identify with different groups feel that they're valued and respected within a certain setting. There's a quote by Verna Myers where she says, diversity is being asked to the party, but inclusion is being asked to dance. So that's kind of a fun way to kind of think about the difference between the two. And then the third important term, equity, is more so about the quality of fairness or the process needed to acquire diversity and inclusion. So a lot of times we confuse equity with equality, where equality is we want everyone to have the same thing, which we do want everyone to have the same thing, but you got to also consider that not everyone is starting at the same baseline, and that baseline is what we're trying to get at with equity. Right. Hope that clarifies it.
Oh yes, absolutely. That really helps cement it for us, the differences between the three. Now, almost always when you tackle topics of diversity, equity, inclusion, the concept of race and ethnicity inevitably will follow. And again, for the benefit of our listeners, would you mind helping us understanding, what are the definitions out there and the definitions you are using when you discuss race and ethnicity?
Yeah, definitely. That's actually one of my pet peeves because I feel like race and ethnicity are used interchangeably so wrong. And especially when you see like forums and stuff and it's like, identify what your race or ethnicity is. It's like a confusing question because they're mixing terms. Excuse me. But ethnicity more so belonging to a social group with shared traditions or culture. So when you look at me, ethnically, I'm comprised of various cultures. I'm African American, Native American, Greek, Danish, Irish, and several other things.
Wow, that's that's a lot of cultures.
Right. And being of mixed cultures and then also biracial is what made me kind of understand the difference in the
Hmm.
definitions.
Hmm.
So then when we talk about race is more so a social construct where it's grouping people based off of shared physical qualities, more specifically color, which we'll probably talk more about later, colorism, which
Hmm.
is essentially racism to me. So when people look at me, my race is considered biracial because I am fair skinned, but I have African American features. So that's the difference between the two. So the race is more so light skin versus dark skin. Ethnicity is actually the cultures you come from.
Okay, so now that we know those two things, how do you think you encounter these issues of concerns with diversity, equity, and inclusion, closely followed by race and ethnicity, as to your everyday work as a PT?
So there's a lot of things I see in healthcare when it comes to all those different topics. And mainly, I feel like what I'm seeing is a byproduct still of colorism, which is, again, the discrimination based off skin color. But you see that groups who experience oppression or discrimination or social and economic inequalities are also the same groups that have higher rates of disease and adverse health outcomes. You see that those individuals are not able to find providers of their choice that they feel they can relate to, whether it's by sharing the same language or just a culture to feel comfortable. Um, Other issues that you see in healthcare is that because of our history of oppression and experimentation, there's a lot of mistrust between minority groups and the healthcare system.
Mhm.
For example, a very well-known thing, but maybe not, are the Tuskegee experiments,
Mhm.
which was a 40-year study where they tested over 600 African American men for studying syphilis, and they didn't tell them what they were doing to them, and a lot of people suffered and died. So a history of events like that doesn't make certain communities, especially the African American community, comfortable with going into the healthcare system. They won't participate in research studies, which provide us information on better treatments and outcomes. Or on the other end, they just don't feel like they're taken seriously when they actually go to their healthcare provider. There's actually even research out there that shows that medical students have biases believing that individuals with darker skin tones have less sensitive nerve endings. So if
Wow.
someone's coming in there for pain and they see the person has darker skin and they have this bias, they might not prescribe those pain medications or the same interventions that they would prescribe to someone else. Um, and then to round it off, another thing that you'll see in healthcare are microaggressions. Either patients are receiving it from the providers, or the providers are receiving it from patients, or providers are receiving it from other providers. And what racial microaggressions are words or behaviors, intentionally sometimes, often unintentionally, where you're communicating hostile, derogatory, or kind of negative slights or insults towards a marginalized group. So for me, an example of a microaggression is when I go places and they ask me what school I went to, and I tell them, which is the University of Delaware representing,
Mhm.
um, they're kind of like taken aback, like, oh, like you went to that school, because the University of Delaware is more known for being a good school, and I'm a minority, so they're just kind of like, oh, okay. Um, so those are just little tidbits of all the things that I've kind of seen in my short time as a healthcare provider.
I'm listening to your story, and especially with the greater sensitivity of our current social situation with the plight of minorities. One of my favorite things that I listened to over the last couple of weeks was four student physical therapists
Mm-hmm.
who discussed racial microaggressions. And
Mm-hmm.
one of the ladies who was African American, she was talking about her hair. I guess she lets it out.
Mm-hmm. Mm-hmm.
And I always thought it was really cool because, as an immigrant in a very homogeneous society, that's not something you see. And I would just say, oh, wow, that's really cool. But
Mm-hmm.
but she was sharing how she worked really hard to make that look good. and random people would just go and grab it. Like,
Yeah.
wow, that's really something that you
Hmm.
have to go through as a person of color, I guess.
Hmm. I mean, what it also makes me think of, and this is again going back to the colorism thing, if I'm going to a job interview, I usually would always straighten my hair because I know that I might be perceived differently than if I wear my hair more natural. And it's just little
Mm.
things that people subconsciously do or consciously do to make sure they can just at least get their foot in the door.
Mhm.
Um, it might be getting a little sidetracked, but it even also makes me think of how people think about using like their middle name versus their first name on their resume because of those racial or ethnic cues in their name. They don't think they won't get callbacks, and there's research that shows those resumes with more ethnic names don't get those callbacks. So people are trying to find a way to, for lack of better terms, be more white because that is the standard of what is supposed to be normal or accepted.
Right, right. Another example that I heard from, again, those students, because the students are going to be the next generation physical therapists. One of them mentioned where we all have our biases, and he shared this resource, the Harvard bias, which you can find online, and it helps
Mm-hmm.
you detect your implicit biases. Like, I
Mm.
mean, I'll cop out. I saw you, and I saw all 6 feet plus of you, and so I assume right away that she must be a basketball player. And that's, I guess, a cute bias, I guess. But
Mm-hmm.
like now I'm listening to you and listening to your lived experience, that's not too many shades away from me thinking, well, she only got in UDL because she's a player, not because she's academically gifted. So I think I
Mm-hmm.
see what you were saying, so
Mm-hmm.
wow.
Yeah, I actually have a lot of friends who are tall black males, and people automatically assume that they played a sport or and they don't want to just be defined by that. Um, so I mean, yeah, I mean, I know I have biases. Particularly, which I've referenced before, is when an older white male comes into the clinic, especially if he might have like a history of dementia, or some type of brain injury, because that's the population I work with. I get concerned because I don't know, one, their filter might be gone, and two, I don't know what where they are in their mind. Like, what are they in the 1960s or are they in the 2000s? So I get kind of not paranoid, but I'm a little on guard because I'm not sure what's going to come out of our encounter, if they'll accept me as their therapist, if they'll even listen to what I have to say. So yeah, we all have our biases, and those biases are shaped off of our experiences, right? I mean,
Mhm.
I'm lucky to be someone who came from a very diverse family, grew up in a really diverse town, but I still have biases. So, I mean, it's inevitable people are going to have them, but it's important to be able to recognize them and then find ways to be better.
It's a stumbling block, really, that idea of accepting that you have a bias.
Mm-hmm.
When I took my test, I actually started having to do history lessons. I'm trying to figure out why am I the way that I am, and I realized a lot of my personal biases came from the kind of media I was consuming when I was coming up. I grew up in 80s Philippines, where it was all sitcoms, and it was a predominant culture that you see in media and TV. And I'll touch that
Mm-hmm.
again later. But for the benefit of my fellow immigrant PTs who may not know, biases towards Filipinos have been happening as well. And if you would humor me, I would love to show you this short clip of a great study about 1920s Filipino immigrant labor and how the oppression and the microaggressions that our Black and Latinx brothers and sisters are feeling, that even people in my culture are not that far removed away from it. So let me just show you this quick video.
Yeah, I'm excited to see it. Definitely, colorism is an issue across cultures. It's not just in the United States.
Late 30s and early 40s, yeah, there was feeling of discrimination back then. Because I remember one time this guy, Johnny Mercado, and we went to some hotel, and right there on the steps, no Filipino allowed. I was shocked to see that. That really amazed me. But it just didn't dawn on me at that time of being discrimination. Just, well, they don't want us, they don't want us, so we took off. But later on, you found out that you couldn't go on the other side of Main Street, or you couldn't own property
in the Fox Theater, which is the main theater in Stockton, we were not allowed, Filipinos were not allowed to sit in the center part of the movie theater. They were relegated to the side aisles against the walls. And that went on through probably the 40s and maybe even the 50s.
Yeah, among people especially among newer immigrants, sometimes because we arrive here as the other in our own way, sometimes we think our concerns of being others is so big that we really shouldn't mind the others that maybe other Americans of color are facing. We're too busy dealing with this, but until I think we address and we are in a brave space to confront these things, the cycles just keep repeating and keep repeating and keep repeating. And so I'm so excited to share stories and to basically hopefully expand a worldview of people like me to understand, there's patterns here and there's things here that we can all do to try to make it better.
Mm-hmm. It's a divide and conquer kind of concept. If everyone is always focusing on what's just happening to them, you can't look outside for change. I mean, that's kind of been the whole point of racism and colorism. It's meant to subdivide groups so that, those, I guess in the past, that poor white population feels more connected to that upper class white population if they can unite over being of the white race. And then blacks and other immigrants, they're the others, they're the problem, or they're someone else. We got to worry about us, even though the upper class is still kind of stepping down on that lower class.
Right.
It's a game. It's a game.
I also love how, we're very settled down on concepts of race and ethnicity. I'm looking at that gentleman talking, right? And that is like a tito, basically a Filipino uncle through and through. You're looking at him, you can't not say he's a Filipino. I close my eyes and I am seeing a old boy from Stockton. I can see him, riding a horse. You can't really make presuppositions who people are and how they are by looking at them. You really have to know their lived experience. And I learned this term, just because maybe I'm talking to you doesn't mean you are representative of all the experience that is being Black America. It's not a monolithic community. There are nuances and shapes.
Right. There's more differences amongst cultures, like within themselves. So yeah, and that's a lot of pressure. I think a lot of minorities feel, especially like in the healthcare sector, because since we are the minorities and then there's not a lot of us represented in health professions, everything you do is not just a representation of what you are as a clinician, but of the whole race. So if someone has an experience with a Black doctor and it's a bad experience, does that mean every Black doctor is bad? No, but people tend to generalize and associate that way.
Well, one of the things I thought which is interesting about diversity is sometimes misunderstood is when we ask for diversity of clinicians, what we're looking for, because it's established in the literature that healthcare seems to be better delivered if the patients who need care share same cultures as the ones rendering care. And like an amazing statistic I saw from the APTA demographic study is 1.8% of the APTA members is from, I think, the Black community. And I'll flash the number here to correct myself if I do. And just from that, you counterpoint that against Department of Human Health Services saying the overwhelming majority consumers of healthcare are Black and Latinx. So just from there's so much potential not attained to give the best care possible because they're just not represented as well as we should, even just using the United States Census as a basis.
Mm-hmm. Yeah, I've found in my experience actually recently with a couple of folks I worked with that you can tell there's one thing, when you share a common culture, I think it's easier to kind of understand what the patient's goals are. we can't just be completely, using a standardized test, and we have to incorporate that. But at the end of the day, it has to be what is functional and what impacts the life of the patient. So what I might think is important might not be what that patient thinks is important. However, if we share the same culture, they might feel more comfortable truly sharing with me what their goals are. What I find actually happens to me is, one, as a physical therapist, luckily we have more time with folks, which I think is a big part of it. So I'll do an evaluation, get through stuff, and then the last few minutes I'm getting like drilled with questions because they're trying to understand things that they were told by other doctors that they were either afraid to ask questions about. A lot of people just don't understand how healthcare is really, it's patient focused. So you, as the patient, even though you're sick, you have to really be the driver. Mm-hmm. So people don't know their rights. They don't know that they can ask questions. They don't know that they can say they don't want something. I've had people ask me about, a doctor said they had to get a certain injection because if they didn't, their whatever was going to get worse. And when I thought about what it was, the intervention wasn't really, it was managing pain, but it wasn't actually changing the cause of their issue. Mm-hmm. So I'm like, are they just not understanding, or is this being communicated to them this way? Do they, like, there's so many factors that, no. And when you're a minority clinician, it's a lot of pressure because you want to be able to help everybody, but you can't carry the weight of the race on your shoulders.
There is so much to unpack there, and how to figure out and how we can be of best service to our patients, especially the one in front of us, especially when they don't look like us. I think that's really going to be the challenge, because I am of the belief that there are people of goodwill in all ethnicities, in all races, but sometimes we just all have blind spots. We just all have blind spots that we can just really do a better job of if we just talk about it with people who don't look like us. I think that's just something which is great. So I want to go to that topic we were talking about. Another topic of interest, especially to U.S. immigrants like me, is colorism. I found a clip from Oprah Winfrey and her guests discussing colorism. We'll go play the clip right now, and then we'll talk and discuss it afterwards.
Because this is an issue that wreaks havoc, particularly in the African American community, but in other communities as well.
In Latin communities, in Asian Indian communities, and even, I understand in some of the Southern Asian, whether it's Chinese, Vietnamese, the issue of
colorism. Colorism, it's called. It is the light skin, dark skin prejudice where people of color discriminate against each other within their own race. Now, it really boils down to the belief that the lighter your skin tone, the prettier you are, the smarter you are.
More valuable and worthy you are.
True. And the easier you have it, that's the perception. So colorism has been around for a very long time. Where did it come from?
Well, its roots are really go all the way back to slavery, where the slave women were bred and created children, and the children became lighter and lighter and lighter and lighter, and that the mother herself was often left out in the field, and she therefore became a field hand, I'll say hand, and the lighter women were taken into the house to serve the mistress, to take care of
the lighter children. Women, they were lighter because everybody came over as Africans.
That's right.
And as brown-skinned Africans,
dark
black Africans.
African Americans today are so far removed from that reality till they don't even recognize the lasting cellular and genetic impact that it still has on us, that we still have colorism, light skin, dark skin, you're better than, more worthy than. They don't even...
And you're better than because the closer you are to being white, the better you are.
You can always count on Oprah and bring that subject front and center.
One thing I do disagree with the video is it's not just within the minority populations. White folks are included in that too, and I feel like that's kind of where it started from. And I think colorism is an issue amongst minorities is because you are able to see that there are advantages and disadvantages. Like I know for a fact that because I'm light skinned, depending on the time of the year, and how I wear my hair, some people don't really know what I am. So that changes how they treat me. So I can understand the frustration that there is amongst these our groups, because you do see that sometimes it is more beneficial to be light skinned because society will treat you differently. And that's just not okay.
From within Filipino culture, again, because of the entrenched impact of the American imperialist times, the Philippines was a U.S. colony from 1898 to 1946. So what that means is my grandparents grew up under American rule, American education, and if we use our imagination, what kind of education was being taught to us in 1940s, they didn't call it colonialism, they called it benevolent assimilation. I mean, I've been learning a lot of history, and I'm realizing now that I now understand why a lot of my generation, or even generations before me, Filipinos, seem to have this bias towards people of the white race because of that history of colonialism. And it's something I think that's come down still to my generation. Like, I'm a golden brown skinned boy, but even within me, I realized I have cousins and relatives who tend to be more fair skinned, and I've never really thought of myself as being as attractive as these cousins just because of the color of my skin. And now having the word for that and understanding that, making you realize, oh, but you realize you're not any less or better than they are. It just means that you are different. And the reason is why did that happen? It's really an artifact of years and years and years of oppression.
Mm-hmm. Yeah, it's conditioning. I mean, it's in everything. If you look at toys, and if you look at cartoons, if you look at books, you don't see people of darker skin. I want to say that specifically because I feel like sometimes when we talk about people of color, it gets lumped in. I mean, all people of color are going through issues, but again, when it goes back to colorism, I think it's going back to that darker skin tone. So you're not going to see those darker folks in those toys, books, stories. And if you do, you also see a lot of times that there's negative connotations associated with the word like dark, black, evil, ominous, scary. But white is purity, virtue, good. So like when you see these words and images associated over and over again, you're conditioned to think that that's what's normal. I was on a panel discussion 2 or 3 years ago, and it was a very interesting discussion because we were talking about people in healthcare who are from Africa, and then people who are African American getting involved in healthcare, and how just the difference in that upbringing. If you're from Africa, in that culture, you'll see Black doctors, you'll see Black nurses. So you think, I can be a doctor, I can be a nurse, because you see it represented. However, in the United States, African Americans don't necessarily see that representation. So their mindset, or our mindset, on what we can accomplish sometimes is skewed because, again, of that conditioning. Even when we were talking about earlier with the hair, all the things about what's considered like a well-kept professional hairstyle when you wear your hair natural and have a fro, or if you have twists and braids or dreadlocks. We've seen this stuff in the news with the kids getting their hair cut.
The wrestler, right.
Yeah.
Mm.
So, and again, it's just trying to make this whiteness a standard and having people subscribe to that. So,
maybe this is just me and my fascination with geek culture, but two major media platforms which I really felt like was very eye-opening to me was, don't laugh, the Marvel movie Black Panther.
mm-hmm.
And I realized I wasn't the only one, especially among the minority community, to actually see what if an African country was not touched by colonialism,
Mm-hmm.
and they are
What if a lot of places weren't?
right. If the Spanish didn't come for 400 years in my country, I'm wondering what kind of culture would it have been.
Mm-hmm.
And that trek down that idea is they are wonderful people, and they are able to self-govern, and they're able to progress.
Mm-hmm.
And they also still have problems, and they have
Mm-hmm.
flawed people. There is power usurping. So that's the one media which made me realize, yeah, that's important. That's important for me and my kids and everybody to see. The second one, which I thought was really amazing, particularly to America, is the play Hamilton. And
I haven't seen that yet.
people are really gonna, it's gonna be on Disney Plus July 3rd, because the genius of Lin-Manuel Miranda was to intentionally color cast people of color, so that in this very formative years that you're conditioned by history books to be only a certain demographic of people, you see that possibility that you can be shapers and you can be important and you can be relevant and not shunted to the side. So anyways, putting that aside for the literature, I want to go back to the physical therapy profession. Since we've been working on, diversity, equity, and inclusion, have you been seeing any changes within the PT profession, within the association? Any progress or movement on how we are better addressing concerns with diversity, equity, and inclusion?
Well, I think what's been good since I've been involved is what I've noticed is people are doing lots of different things in different pockets. And now it's kind of getting to the point where we're trying to kind of bring it all together. And also people are starting to become more aware of diversity initiatives. So like recently, some of my coworkers have reached out about being more involved in the APTA. They've been members for years and didn't realize, the diversity initiatives that were going on. And they have a need and they want to help implement that need. So that's what's been really great and exciting. And it's been interesting to see what speaks to different people. So for some folks, they want the research. They want to do journal clubs or book clubs where they can look at something and then talk about a topic. Other folks want to do more community outreach. So how can we get out to the communities and tell them what our profession is and how they get into it? And then other folks want to just have mentorship. So trying to connect minority professionals, minority students, to create that network on how to deal with diversity issues just moving forward within the profession. So it's been exciting to see the little different pockets of ideas that are coming up and people are starting to connect. To this day, there's way more minority professionals that I know within the past 2 or 3 years that I would have ever expected to even encounter. So,
And Jasmine, you and I and the physical therapy profession, we're not going to solve something as structural and as complex like this over a podcast or over a couple of weeks. But I can tell you firsthand, my experience is I have known from a head knowledge point of view the issues and the heartaches of our Black and Hispanic and Latinx community with oppression. And I have always tried in my practice to be mindful of that and to be sensitive to that. But I do ask all my colleagues, especially my immigrant physical therapy colleagues, the head knowledge of the oppression, it becomes heart knowledge once you actually have relationships with people from these cultures. And I'm not talking about 8 to 10 or 8 to 5 or the patients that you're serving, but having that real connection and just listen to their stories. And it's none for us to save people. Nobody's salvation is else but their own. But just to listen to their stories, and I'll vouch, the stuff you have shared with me, Jasmine, has really expanded my worldview, and that's why I decided I really hope that we can use this platform as a way to springboard better bridges in communication between the cultures.
Mm-hmm. Yeah, I mean, if you don't talk to people, you don't know. I think it's helpful if people are able to find ways to expose themselves to different cultures outside of healthcare, because if you think about if you only see a certain demographic because of where you work, you're seeing that group of people at their worst. They're sick, they're frustrated, they're tired, they've been going here, going there, now they got to tell you everything and see if you'll listen. So you're not getting like the best impression of them. And again, then you generalize and like, oh, all people are this way. But that's not the case. That's why it's important to expose yourself to different people. It doesn't mean you have to be best friends with everybody, but at least put yourself in situations where it's not homogeneous.
Multicultural nights, that seems so simple, but that's it. The food is what causes the bridges. What do you call this? Yeah, multicultural night. I think that's the biggest and easiest way. If you hear that, really make an effort to participate in that, and you'll be we are all surprised by what we learn about each other.
Yeah.
If any of our PD colleagues would like to learn more and actually be engaged with DI initiatives, could they contact you? Are there resources that they can reach out to so that they can be able to do more?
Yep, there's quite a few things that they can reach out to. So they can definitely reach out to me or the ABTA-NJ Cultural Diversity Committee at culturaldiversityptcommittee@gmail.com. Also nationally, you can reach out to APTA at DEI@apta.org if you have questions about what they're doing at the national level. There's also the HPA Catalyst, which is a good group within the APTA that you can go to at aptahpa.org. And then the other two places I would recommend are PT Proud for the LGBTQ plus community and issues around that population at ptproud.org. And also a shout out to Lisa Van Hughes. She has the Ujima Institute, which is at the ujimainstitute.com, which is also a great resource on being an ally, bias training, and just other discussion topics. I think Maria was on there for one of the
Yes.
villages discussions that they have. So
Yeah.
there's a bunch of different things out there, but they can always, again, reach out to me too.
All right, that's great. Thank you so much, Jasmine. Your work and the people you are inspiring are certainly making a difference to the PT profession and to all the lives that you're touching. I am so grateful for your time.
Oh, thanks, Ben. I'm glad I could be here. Yay!
Now, thank you to all our listeners, and hopefully you learned something about this very timely topic, and we will catch you next time.
Thank you for listening today to the Life in Motion podcast. Striving for excellence doesn't demand perfection. Just be a little better in all that we do than yesterday. This is Ben Aguila. Till our next episode. God bless.